look at the experts' projections. Joining us now is Professor Jomar Rabajante. He's a data analytics researcher from the UP Pandemic Response Team. Good morning to you, Professor Rabajante.
Good morning. Good morning, everyone.
Okay, so last week, the WHO and the DOH said it's too early to say if we reach the peak of cases, but we're seeing record high cases the past few days. So what's your projection? Can you say that we have already reached the peak, or are you seeing a decline?
Yes. I should ask. Sorry. Hello. Can you hear me?
Go ahead, Professor.
Okay. So there's some lag in the video. Anyway. What I can say now is, in terms of mobility, based on Google Mobility, mobility is low compared to the December and November 2021 levels. Actually, our mobility went back to October 2021 levels. So this means that we need to focus more on the households, workplaces, and our individual spaces. As we have seen in the share of cases, the percentage of cases compared before, 70% is the share of NCR. Now it's down to around 50%, which means that the outbreak is now having ripples in the provinces. And this is very important to be noted because we know in the provinces we have very less vaccination coverage. Less than 40% in Visayas and Mindanao, and less than 50% in other parts of the zone, compared to more than 70% in NCR, compared to the whole total population. And also, we have very less booster coverage for the A1 and A3 population. In A1, less than 30%, and A to A3, less than 20%. Why I'm saying this? Because if the outbreak is now having ripples in the provinces, this might be very critical because the healthcare capacity in the provinces are not that high compared to NCR. Now, in terms of our projections, there are some indicators that the cases in NCR is slowing down. Again, slowing down, this doesn't mean decreasing. It's still increasing, but slowing down. But we should be cautious in interpreting this. Why? Because we need to be cautious in interpreting if this is an indicator of peaking, no? That the epidemic curve is peaking already because we have limited testing capacity. In the coming days, we need to see sustained decline in positivity rate, cases in emergency rooms, which we have data on this, and hospitalizations. Although for hospitalization, there might be a week or 2 week lag with this one. And in our calculation, while data is lacking due to lack in tracing and testing, we can do somehow calculations, theoretical calculations for the prevalence. In NCR, this is actually kind of scary for some people, but I need to be transparent with this one. The prevalence that we have calculated is that 10 to 20% in NCR last week might be 10 to 20% in NCR is the number of active cases last week, which might translate to around 1 to 3 million active cases last week. Or nearly every household has one positive case. And as an anecdote, we can remember that many of our friends have family members who turned out to be positive or have symptoms. And
okay.
Yeah.
Yes, Professor. So, medyo maganda naman po yung explanation nyo. No? I just want to be clear na so sa Metro Manila, tataas pa rin po, but what you're saying is magsuslow down na. Is this already the peak in Metro Manila? Kasi DOH is saying it could be end of January or second week of February for the peak. And yung point nyo rin isa ay tataas naman sa other provinces. So ano po ba yung mangyayari, yung expected natin mangyari like for this week? Will it go up or will it go down?
Yeah. For NCR, it is slowing down. There are some indicators of slowing down, but it is still increasing. No, I need to clarify this because people might be confused. Na baka decreasing. No, the numbers can still be increasing, but slowing down in terms of the acceleration. Actually, it's really very hard to see very large increase in the reported cases. Again, reported, no? Because there's limited testing capacity. Somehow, the testing capacity is pushing our numbers really to be somehow plateauing. But in terms of estimating, no, sabi ko kanina, what we have calculated is around 10 to 20% prevalence in NCR. Actually, there are some consistency with this one because last week LRT and MRT did antigen test, no, in their commuters.
Yes.
And it also turned out around 10 to 15% to be positive. So yung 30 to 40 reported cases natin ngayon kasi around nasa malapit na tayo sa 40, no. So yung 30 to 40,000 reported cases natin might be really in terms of actual number times 10 nito, 300 to 400,000 cases if we are going to include the undetected cases. So somehow this might translate na baka we are already slowing down because many people are already infected with the virus.
Okay, thank you very much for that information, Professor Jomar Rabajante from the UP Pandemic Response Team.